What do you do when your child ingests kerosene? What are the do's and don'ts of accidental or non-accidental kerosene ingestion? Let us discuss kerosene poisoning. Not many of us have access to electricity for lighting, and even those who do need kerosene once in a while during power shortages. Now, utilizing kerosene is not the problem here. It is the storage of this fuel that poses a great risk, especially in homes with toddlers and children. Most of us can attest to the fact that they have seen kerosene being stored in beverage bottles not once or twice. In most of our homes, kerosene is stored in soda bottles, juice bottles, water bottles, and there's usually no effort to hide these bottles, at least out of easy reach. It's probably ignorance. Parents do not understand that kerosene consumption can be very fatal, especially to the young. Kerosene poisoning accounts for many of the accident and emergency department visits and even hospital admissions. What is saddening is the majority of the population do not know what to do in such situations. People do whatever they think might help during that panic moment and sometimes cause more harm than help. Kerosene is a hydrocarbon. Hydrocarbons are a diverse group of organic compounds consisting primarily of carbon and hydrogen atoms arranged in various aliphatic and aromatic configurations. You can pause the video to look at some of the other products that contain hydrocarbon. Toxicity of hydrocarbons depends on one, physical characteristics like volatility, viscosity, and surface tension, which majorly determine the aspiration potential. The less viscous it is, the greater the risk. The lower the surface tension, the greater the risk. It also depends on the chemical characteristics, the route of exposures, concentration, and the dose. On the clinical presentation, immediately after ingestion, the patient will start coughing, choking, gasping for air, will have difficulty in breathing, and a burning sensation in the mouth. These early effects result from irritation of the oral mucosa and the tracheobronchial tree. Patients with these symptoms will be assumed to have aspirated until proven otherwise. Do not induce vomiting. Vomiting increases the risk of aspirating the kerosene into the lungs. The most feared adverse effect is aspiration pneumonitis. Most deaths from this complication occurs within 24 to 48 hours. Necrotizing pneumonitis and hemorrhagic pulmonary edema usually occurs within hours in severe aspiration. Kerosene toxicity results from direct aspiration into the lungs. Damage is not dependent on the volume. Even 0.2 mils aspirated can cause pneumonitis. Aspiration will result in direct toxicity to the pulmonary parenchyma, altered surfactant function, increased vascular permeability and edema, bronchospasms, ventilation perfusion mismatch, pneumatocysts, bacterial superinfection, acute respiratory distress syndrome, even death. The nervous system and the gastrointestinal system are usually affected, though not so commonly, and their manifestations are usually mild. Examination findings include grunting respirations, retractions, tachypnea, tachycardia, cyanosis, fever. An odor may be noted on the patient's breath. ABGs will show frank hypoxemia and sometimes wheezing. Most patients with clinically significant aspiration have abnormal chest X-rays. Radiographic changes usually appear by 2 to 6 hours and are almost always present by 18 to 24 hours if they are to occur. Initial radiograph in the symptomatic patient may, however, be deceptively clear, so observation for 6 hours and delay of imaging is required. Treatment is usually supportive. For a stable patient, observe for 6 hours. If asymptomatic with a normal chest X-ray, discharge home but initiate follow-up because delayed toxicity has been reported before. This is why some physicians lengthen the observation period to 24 hours. In an emergency setting, administer oxygen. Nebulized oxygen is helpful in the treatment of pulmonary aspiration. Inhaled beta agonists are good in the setting of bronchospasm. PEEP and CPAP may sometimes be required, but because of the potential injury from barotrauma, observe for the development of pneumatocysts and pneumothoraces. Start antibiotics in cases of superimposed bacterial pneumonitis. Avoid corticosteroids because they impair cellular immune response and increase chances of bacterial superinfection. I'm Dr. Tinash Pink. I hope this information was helpful. Do not forget to like and follow for more informative sessions. Also, feel free to comment on topics that you wish to be covered. I wish you a great time and thank you.